Welcome back, everybody. XFiz guy here, and we're going to do today a very basic introduction to cardiovascular anatomy and physiology, mainly blood flow. We are not going to get into anything very complex today. We just want to do an introduction, a very basic introduction on structure and blood flow. Now, I know the board is a little hard to see and there's a lot of writing and everything on there, but I'm going to go over it with you step by step so that hopefully it's a little easier to understand. If we look at the board, the very first thing I want you to look at is basically ignore everything other than the big red circle that I have on there, which is this right here. This big red circle. That is in essence what we are going to use for our heart. That's what the heart is going to look like on our board. All right. For exercise physiologists, I usually always tell them to think of the heart in that it has two sides, a right side and a left side, and that it has four chambers. 1, 2, 3, 4. Also, there are 4 valves. Now, they're a little difficult to see on the board, but I've marked them with these little black V's. Now, it's extremely basic. This is not drawn to scale. This is not anatomically perfect, but it gets the point there, and it gets the important intro points across. So, 2 sides, 4 chambers, 4 valves. Also very important. Blood flow throughout the human system is always meant to be one way. Whether we're in the heart or we're in an artery and a skeletal muscle or in the lungs, wherever we are, blood flow should be one way. Now, a little extra anatomy here. These dotted green lines on this side over here, these represent the largest vessels of the body known as the Vena Cava. The superior vena cava, meaning it's just above the heart, above the base of the heart. The base is actually up here. The base of the heart is at the point of the right atrium. RA stands for right atrium. And the apex is actually what we would think of as the bottom. So it's a little sort of backwards because we always think of apex as the peak. But so you have your superior in vena cava, which is above the right atrium, and the inferior vena cava, which enters in below the right ventricle. So, RA, right atrium, that's how it's going to be abbreviated. RV for right ventricle. Left atria is LA, and left ventricle is LV. So we'll get those sort of out of the way. Coming out of the top over here, we have the aorta, which we will get into, and then some vessels over here as well. So the black lettering and writing down here, I know it's very difficult to see. I'm going to go through it step by step. Step number 1, blood is going to enter the right atria through both the superior and inferior vena cava. Flows in through the right atrium. The right atrium is then going to deliver blood to the right ventricle, and that blood is going to flow through the tricuspid valve. So tricuspid valve. Now that the blood is in our right ventricle, the right ventricle is going to contract and push blood through the pulmonary valve. That blood is going to travel along the pulmonary artery and into the lungs. Now, you'll hear a lot of people say all veins carry deoxygenated blood, or all arteries carry oxygenated blood. There's only one exception to that rule. The pulmonary arteries carry deoxygenated blood from the right ventricle to the lungs. The blood on the right side of the heart, whether it's in the atria or the ventricle, is always deoxygenated. So, blood flows through the pulmonic valve into the pulmonary artery. Blood then goes to the lungs where it gets oxygenated. We're not going to cover that today. After it's oxygenated, it's going to return through the pulmonary vein. Remember, this is oxygenated blood from the lungs to the heart. So the more correct statement is that every artery carries blood away from the heart, whereas every vein carries blood to the heart. blood flows from the lungs to the pulmonary vein into the left atrium. The left atrium is going to then kick, if you will, blood through the mitral valve or bicuspid valve. You may hear it called either one. That blood is going to flow into the left ventricle. When we're in the left ventricle, this is the largest chamber and has the most muscle mass. So this is going to contract very forcefully. It's going to push blood through the aortic valve. My marker is running out here. Aortic valve, which is right here. Okay? And then it's going to flow through the aorta and into the rest of the body. So that is a very basic 101 introduction to the heart and its anatomy. So there it is right there. Heart and its anatomy. Very crudely drawn. And a nice little write-up and description of blood flow. So I hope this helped, guys, for a very basic introduction. And hopefully I can get some more intro videos like this up and possibly some more advanced ones as well.